Good afternoon. We are going to begin tonight. Welcome to Madison VA Hospital's live telephone town hall. Our leadership team is excited to hold this teletown hall with women veterans who use the Madison VA or any of our 6 community-based outpatient clinics in Baraboo, Beaver Dam, Janesville, and Madison, as well as Freeport and Rockford, Illinois. I encourage you to stay on the line with us and participate. This gives you an opportunity to speak live with us and ask questions about your VA health care. My name is Maddie Alvarez. I'm the Facility Women's Health Medical Director, and I'll be moderating this afternoon's call. Thank you for taking the time to join us. We have a panel of Madison's VA leadership team here to provide information and answer your questions. We also have staff from mental health, whole health, community care, primary care, and several other areas to assist in answering your questions. We hope this teletown hall provides a more convenient way for you to speak with Madison VA leaders and get answers to your questions. We are able to reach more women veterans so we can ensure we hear your voice and focus on what's important to you. Please note, for the next hour, we'll provide information on the East and Baraboo Clinic updates, new pelvic floor physical therapy, preconception care, Go Red event, suicide awareness, and integrated health and wellness updates. Then we'll have a live question and answer session. And if you would like to ask a question, just press 0 on your phone, and you'll be connected with a staff screener who will take your question and get you into the queue to speak with our panel. We'd like to address as many of your questions as possible during this call, so we have to limit participants to only 1 question each. If you do get on the air, please remember that other veterans are in line to ask questions, so keep your questions brief, and please do not share your personal health information in this public forum. If we are not able to answer your question on air, we'll make sure to follow up with an answer to your specific concern. We want to make sure all questions received are answered. If we don't make it to your question by the end of the call, be sure to stay on the line, and you'll have the opportunity to leave us a voicemail so someone can get back to you. First, I'd like to welcome our Facility Director, Christine Kleckner. She comes with several years of experience and has served the Veterans Health Administration for 33 years. I'm going to turn the call over to Ms. Kleckner for opening comments.
I'm happy to be here with all of you today and looking forward to hearing from you. I'm excited and honored to be the new Madison VA Executive Director. I have served as the Associate Director for 7 years and the Assistant Director for 5 years here at the Madison VA. I've been with the Veterans Health Administration for a total of 33 years, with more than 2 decades of experience as a clinician and manager before stepping into executive roles. I look forward to continuing to enhance programs and services, promote patient safety, and deliver the best care through our Madison VA hospital and clinics. I look forward to your questions in a little while, and thank you for your participation.
Thank you, Director. Our first update is on preconception care that we are now providing at the Madison VA. Rachel Mays, our women's health pharmacist, will provide us an update.
Thank you, Maddie. The Madison VA Women's Health team is excited to share the availability of preconception counseling for our veterans. Preconception counseling, or preconception care, provides veterans of childbearing potential the opportunity to discuss their reproductive health goals and identify ways to improve overall health prior to becoming pregnant. In doing so, we hope to reduce pregnancy-related complications and provide a foundation for a healthy pregnancy. As part of a preconception counseling visit, veterans can meet with the Women's Health Clinical Pharmacist Practitioner, that's me, my name is Rachel Mays, to gather a health history, including medical conditions and their management, vaccine history, and lifestyle factors, as well as review prescription and over-the-counter medications or supplements to ensure safety in pregnancy or lactation. After this review, we can determine an appropriate follow-up plan, which may include lab monitoring, medication changes, or referrals for additional care. If you are interested in learning more about preconception counseling or in scheduling an appointment, please contact the Women's Health Clinic at 608-280-7209 and ask to speak with Rachel Mays. Again, that number is 608-280-7209. You can also reach out via My Healthy Vet secure messaging using the Women's Health Care Coordination Triage Group.
Thank you, Rachel. Our next update is on the Baraboo and East Clinics. Starting with our Baraboo VA clinic, the build-out of the new clinic is nearing completion, and we plan to open the clinic doors in late spring. The new clinic is located less than a mile from its current location at 414 State Highway 136, Baraboo, Wisconsin 53913. It's next to Anytime Fitness and across from the BP gas station. What makes this new clinic extra special is that it will be twice the size of the existing clinic, from the current 4,863 square feet to 10,000 square feet. The clinic will be staffed by 30 VA employees, and the extra space will be used for an additional patient-aligned care team, or PACT, an additional telehealth room, space to provide podiatry nail care service, and a dedicated lactation room for veterans and staff. The expansion also provides space for physical and occupational therapy services and will allow us to expand nutrition and whole health classes. We look forward to providing more information on the grand opening this spring once that date is set. We are also excited that our brand new Madison East VA clinic will be opening this summer. The clinic is located at 4904 East Park Boulevard, Madison 53718. It's in the American Center Development Area near the intersection of Interstate 9094 and Highway 151. The East VA Clinic will offer access to services that some of you, especially those receiving care at Beaver Dam, may find more convenient than coming to the main hospital campus. The clinic will provide primary care, including a dedicated women's health PACT, physical and occupational therapies, nutrition services, including a healthy teaching kitchen, mental health, telehealth, blood draw, radiology x-ray, and several whole health services. The new East VA Clinic will be staffed with several providers who are currently located at our West Clinic, and in the next couple of months, we'll communicate changes to provider locations and options for establishing your health services at our new East Clinic. Once East Clinic opens, part of the West Clinic will undergo light renovations. You may have also noticed quite a bit of construction occurring behind our main building along the University Avenue parking lot. We have made good progress on an employee parking garage. Construction for the employee parking garage started on May 15th, with an anticipated completion date of around June of 2024. Visitors and veterans should not be impacted, and you can still park on floors 1 through 3 of our parking ramp. Our next update we have is from Ingrid Taylor. She is our new pelvic floor physical therapist. Prior to becoming a physical therapist, Ingrid was a doula in Seattle. She has her BA in physiology from the University of Minnesota and a doctorate of physical therapy from the University of Wisconsin. She has continued her education with pelvic floor training and visceral manipulation training. She comes with a great wealth of experience, and we're happy to be offering pelvic floor physical therapy now at our Madison VA. With that, I will turn it over to Ingrid for an update.
Hello, I am so happy to be here. You may or may not have heard of pelvic floor physical therapy before, and I want to give you some more information about what this service offers. Pelvic floor physical therapy works with the sensitive stuff that we only tell our closest friends, partners, doctors, or keep to ourselves. Things like urinary leakage, fecal or gas leakage, prolapse, pelvic pain, or pain with sex or orgasms. Pelvic floor physical therapy works with a lot of different populations: transgender, menopause, prenatal and postpartum, after the loss of a pregnancy, military sexual trauma, and hypermobility. Pelvic floor physical therapy is not just Kegels. Sometimes Kegels can make urinary leakage or pain worse, and it's important to make sure your pelvic floor can relax as well as contract. So what does pelvic floor physical therapy look like? We have an initial evaluation where we talk about your history and symptoms, and then look at how your back and your hips move. your general strength, your ab muscles, and breathing. Often, a pelvic exam is performed in the first or second visit. Pelvic exams are always optional. I don't use stirrups or speculums in my pelvic exam. The pelvic exam is to learn about how the pelvic floor muscles work, how they're working together or not working together, and potentially causing pain. Without an internal assessment, it can be difficult to know how the pelvic floor muscles are doing when you try and do a Kegel or relax the pelvic floor. We will then talk about your goals for pelvic floor physical therapy and decide what the plan will be moving forward. We then meet regularly to work on strengthening, stretching, and coordination to help you reach your goals. If pelvic floor physical therapy is interesting to you, please talk to your primary care provider for a referral.
Thank you, Ingrid. Now we have an update from Margot Edge, our LGBTQ+ coordinator.
Hello, my name is Margot Edge, and I am the Madison VA Hospital and Clinic's LGBTQ+ Veterans Care Coordinator. We are in the midst of winter, and the LGBTQ+ health program has been working on a number of initiatives to further our mission to provide an inclusive and welcoming environment, improving and expanding LGBTQ+ services, and providing comprehensive education to all staff regarding LGBTQ+ healthcare. Some of these things include our Gender Neutral Bathrooms project, reviewing access to essential gender-affirming care, and improving sexual orientation and gender identity, also called SOGI, data collection. Everyone has a sexual orientation and a gender identity. The VA is required to collect SOGI data on all veterans. That is not the only reason why we do it. We do it because it helps us provide the most comprehensive care to each of you every day. Sexual orientation, sexual health, sex assigned at birth, gender identity, gender expression, pronouns, and preferred name are essential pieces to provide excellent care to all of our veterans. We need your help with SOGI data collection. We have sexual orientation clinical reminder that your providers will ask you about annually. Additionally, you can update your preferred name and gender identity one of two ways: by going to your va.gov profile and updating the preferred name and self-identified gender identity fields, or you can call our eligibility and enrollment office at 608-280-7038. Again, that phone number is 608-280-7038 to request to have these fields updated at any time. If you would like to update your legal name or birth sex field in your medical record, you can contact the privacy officer at 608-256-1901, extension 11699. Again, that extension is 11699. It is our mission to provide excellent care to all of our veterans. You can contact me, your local LGBTQ+ Veterans Care Coordinator, at 608-256-1901, extension 10762. Again, that is extension 10762 for any questions, concerns, or assistance in getting connected to LGBTQ+ services.
Thank you, Margot. I'd also like to say that we have an exciting event coming up on February 2nd. It is Heart Health Awareness Day, and we will be having a health fair at the main facility from 9 a.m. to 1 p.m. We will also be doing demos on how to do hands-only CPR, blood pressure checks, nutrition heart healthy snack demonstrations, a couple of games to play, and other boosts with information and resources on your heart and ways to improve your heart health. All really great things to do and know. If you come out if you can, as we look forward to seeing you. Again, the health fair will be on February 2nd from 9 a.m. to 1 p.m. at the main hospital. To view the dates and times, you can go to our Madison VA website at www.va.gov/Madison-health-care and scroll down to the events section. The details will be listed under the topic of Go Red. Again, the website is www.va.gov/Madison-health-care. Next, we want to take the opportunity to learn from all of you. We have a couple of voting questions for you. Our first question is, Do you know that your Women's Health designated primary care provider can do your Well Women's exam, including a Pap test and pelvic exam? For yes, press 1. For no, press 2. Again, the question is, do you know that your Women's Health designated primary care provider can do your Well Women's exam, including Pap test and pelvic exam? For yes, press 1. For no, press 2. Yeah, looks like we're getting a good number of answers, and it's about 3/4 do know that the answer is yes, and 1/4 no. So for those who didn't know, your Women's Health primary care provider can do your Well Women's exam. Our second question, do you know that your Women's Health designated primary care provider can address general women's health care concerns? For yes, press 1. For no, press 2. Again, the question is, do you know that your Women's Health designated primary care provider can address your general women's health care concerns? For yes, press 1. For no, press 2. Again, we're getting a good number of responses, and it seems a few more understand that the answer is yes, that your Women's Health designated provider can answer your women's health questions. Our third question we have is, do you know that we send out a quarterly Women Veterans newsletter via email? For yes, press 1. For no, press 2. Again, our question is, do you know that we send out a quarterly Women Veteran newsletter via email? For yes, press 1. For no, press 2. All right. And again, we have a good number of responses right now, and it looks like not many of you do know. We have about 1/3 of the people know that we do send out an email. So this is a great chance to get that information out to you all. And for those who are unaware, to sign up for our Women Veteran newsletter, you can go to our Madison VA homepage, again at www.va.gov/Madison-health-care, and scroll down to the bottom of the page and select Subscribe to VA Madison Healthcare News and Announcements. Well, thank you for all of your responses. It is wonderful hearing from all of you. We have a few more updates on suicide prevention, our new East and Baraboo clinics, and whole health. However, we're going to take a few minutes and answer a few questions. Again, to ask your questions, press 0 and speak to one of our operators. So our first question is, looks like we have Mary from Stockton. Mary, you can go ahead with your question. Mary, can you hear us?
Yes.
You can go ahead with your question.
My question is, does VA provide hearing aids?
Hi, Mary. Yes, the VA does provide hearing aids. The first step, of course, is qualifying for VA healthcare, which it sounds like you are already receiving your healthcare from the Freeport clinic there. So the next step would be to be getting your state hearing evaluation from a state qualified audiologist. And you can talk with your team there in Freeport, and they can help you get that set up. Just keep in mind, not everyone will qualify for hearing aids. There are certain criteria that do need to be met, and they can go into greater detail for you on those criteria. Does that help to answer your question?
Okay. Thank you for the question. Our next question is from Kathy from Oconomowoc. Kathy, go ahead with your question.
Hello. I just wondered if you could explain Mission Act and how it works.
Hi, Kathy. This is Melissa. So Mission Act was put in place to ensure that the veterans were receiving timely and accessible care. So depending on the veteran's eligibility and wait time, drive time, those all go into play to determine if the veteran qualifies for care in the community, and the VA will cover that care, or if they don't, then it would be at the VA. Did that make sense? So for eligibility, we have, for primary care, if you do not live within 30 minutes of a VA that can provide primary care for you, then you would be eligible for community care. A referral has to be placed, and then you will be reviewed and approved. For specialty care, it is 60 minutes. If you don't live within 60 minutes of a VA that can provide that care for you, then you would be reviewed for eligibility to receive that in community care.
All right, well, thank you for your question. If you still have more concerns, then you can always follow up with your PAC team and we can help to answer those questions or answer anything else. All right, we're going to go on to a couple of more updates. Next, we have Andrea, our Suicide Prevention Program Supervisor, with a suicide prevention update.
Hello, good evening. Women are the fastest growing group in the veteran population, and according to the 2023 National Veteran Suicide Prevention Annual Report, there were 350 suicide deaths among women veterans in 2021. And this indicates a rate that is 166% higher than non-veteran U.S. adult women. When we look at how women veterans are dying by suicide, it's notable that firearm suicide rates among this population is 281% higher than non-veteran women, highlighting the need for increased education and resources on lethal means safety for our women veterans. If you have firearms and would like free cable gun locks to put time and space between the thought and the trigger, please let your VA provider know, and these can be provided to you. For more information on firearm safety, please check out the website keepitsecure.net. That website again is keepitsecure.net. Women veterans experience unique challenges related to their military service, including readjustment challenges, post-traumatic stress disorder, military sexual trauma, trouble sleeping, and even physical injury. These unique experiences can increase the risk of suicide and require targeted solutions. The more knowledge the community that surrounds women veterans has regarding how to identify when a person's at risk and getting them connected to care, the more effective we will be at saving lives that would otherwise be lost to suicide. If you are a part of a community group or know of a group that might benefit from free VA suicide prevention gatekeeper training, it's VA SAVE training, please contact the Suicide Prevention Team at 608-256-1901, extension 11778, and request a training. The number again for suicide prevention is 608-256-1901, extension 11778.
Thank you, Andrea. Next, I would like to tell you about our peer support socials and events. Currently, we have 2 monthly Women Veteran Socials, one in Freeport, Illinois, at Amigos on the 4th Thursday of every month. Again, that's Amigos on the 4th Thursday of every month in Freeport, and one in Baraboo, Wisconsin, at the Tin Roof Dairy on the 1st Wednesday of the month. Again, that's the Tin Roof Dairy on the 1st Wednesday in Baraboo. For information about peer support services, please attend the Peer Support Office Hours in the Patient Education Resource Center, or PERC, on Mondays from noon until 4 p.m., and Wednesdays and Thursdays from 8:30 a.m. to 12:30 p.m. Another group that is offered to women veterans only is Transforming Health and Resiliency through Integration of Values-Based Experiences, or acronym of THRIVE. THRIVE is a group session that is facilitated by a team of medical providers. The same veteran group meets for 14 weeks. Together, we explore health topics that honor your whole person, mind, body, spirit, and community. We share stories, have lively discussions, and discover helpful resources available to you throughout the VA and your surrounding community. If you're interested in Thrive, let your primary care provider know and they can place a consult. Our final update is from our Whole Health System Coordinator, Sarah Rogers.
Good afternoon. I am grateful for the opportunity today to share with you information about Whole Health. Whole Health is an approach to healthcare focused on partnering with veterans to support them in achieving their healthiest, best lives. You may be wondering, what makes Whole Health different? Whole Health centers around what matters most to you. The goal is to center a veteran's care around what they value most, to empower and equip them to discover their personal path to health and wellness. At the Madison VA, women make up about 15% of the veterans we serve, and they are 18% of the veterans engaged in whole health care. This matches a national trend in which the focus on wellness and values really resonates with veterans who are women. At our VA, the Women's Health primary care teams have shown an early and strong commitment to providing this approach to care. You may hear your provider ask something like, what matters most in your life? Set shared goals with you and connect this to your personal health plan. You may be referred to health coaching to support you in working towards your health goals. You may also hear about new complementary and integrative health offerings, such as meditation, yoga, and Tai Chi. The Madison VA offers numerous health and wellness-related services to meet veterans' unique needs and interests. The MOVE program assists veterans who would like to focus on weight management goals. GeroFit is an exercise program for veterans who are 65 and older. The Empower program partners with veterans with chronic pain to offer tools and skills to help improve functioning and quality of life. The Integrative Health and Wellness program offers a variety of health education, movement, and mindfulness-based classes, as well as individual services like health coaching, functional nutrition, and many more to choose from. There are also services held specifically for women veterans, including a Move the Body exercise class for women. A Women's Thrive group focuses on the many aspects of women's health, wellness, and resiliency. There's really something for everyone on every kind of health and wellness journey. If you'd like an introduction to Whole Health, call us at 608-256-1901 and dial 12537. Once again, that number is 608-256-1901, extension 12537 for an introduction to Whole Health. Thank you for your attention, and I wish you and yours a happy and healthy 2024.
Thank you very much, Sarah. Such wonderful programs available. Right now, we're going to take a few more questions. So first, we have Pamela from Peshtigo. All right, Pamela, what's your question?
Hi, thank you, ladies. My question is, I retired a long time ago from the Air Force, and my VA rating was at 20%. However, since then, I've been not re-diagnosed, but the PTSD has gone from PTSD to complex PTSD. I have an excellent therapist in Menominee, and we've been working together since May. However, my question is this. If I need to increase the percentage of my disability, I'm not exactly sure how to go about that. So if you could help me with that, that'd be great.
Sure. Hey, it's Dr. Marsh. Thank you so much for your service, and I'm sorry that the PTSD is getting worse. So several options here. So it's possible that you could go back and just say, hey, my PTSD is worse, and you might warrant a higher rating. It is possible you could say, well, my diagnosis now has these additions, and you could say they were either caused by or this is now a clarification of your previous diagnosis. So those are options as well. What I was going to recommend is if you know who your county veteran service officer is, that's usually the best route to go because they can help you with making that claim to say, and again, you have options, and you could do both. You could say, I want an increase and I want a new condition. And the other option, though, is you can call the VBA, or you can go online and make that request directly online to the VBA. And then what will happen after that is they will set you up for an appointment with one of the Comp and Pen people. We used to do them here. They're done in the community now, so hopefully there'll be someone close to you that you can see. And then they will kind of talk to you about what's going on right now. They'll review your records, and then they will then pass that along to the VBA, who hopefully can help with your rating. Does that help?
Yes, it does help. I do have initial copy because I worked in the medical field as well. So I do have an initial copy of the original medical record. So, yeah, okay. So I guess I'll start there and see what happens. My situation is that I really wasn't going to do anything at all. I mean, I just never have, but with it getting worse and in May it was really dark, so I have to make sure I'm doing whatever I can to take care of myself.
Absolutely, and you absolutely should make that claim. I mean, that's what we're here for, so please do so, okay?
Gotcha. Okay, thanks, Doc.
Sure.
Thank you very much for the question. Our next question is from Judy from Toma. Judy, what's your question?
Yes, I'm fixing to travel out of the country, and I'm 100%. Would I be covered if I went to the hospital overseas?
Hi, Judy. My name is Christy. I'm in our eligibility department. Now, I don't know specific information for traveling out of the country. However, I do have the phone number for the foreign medical program, so you can give them a call and check and see what you would possibly be able to utilize while you are out of the country. So their phone number is 877-345-8179. Again, that's 877-345-8179. There is also some information on va.gov. If you just put in the search engine foreign medical program, there's a whole brochure on FAQs on there, so that might be helpful as well. Also has other phone numbers if you are out of the country, but definitely call that number first and see what you would be eligible for.
All right, thank you for your help.
You're welcome.
Thank you for the question. Our next question is from Judy from Boscobel. Judy, what's your question?
Hi, yes. I had a question about how things work with like breast health, because I have cysts and we've gotten to the point, it's been 6 years and now there is a lump and it has not been biopsied yet. So I like information and making sure I know how things go about. So I was wondering how the VA does reconstructive surgery if needed, or how that would work in general. I am 100% with my VA medical stuff as well.
Yeah, thank you for the question. This is Maddie Alvarez. I'll be hoping to answer your question. So the VA, we don't necessarily offer all of our services within our facility, but we do cover a lot of breast care. So we cover mammograms and additional imaging if that needs to be. And if you need things like a biopsy or potentially surgery to remove a lump, or if it is hopefully not, but if it were to be cancerous, we would cover radiation and chemotherapy and reconstructive surgery at that point.
Yeah, so I do all my breast health out of town already. I think my primary care doctor was scared of my vagina, and even knowing that I had breast issues, they didn't do an exam because they knew I already had stuff, which I thought was kind of weird. But with it, like I said, I've got a rare brain disease. I've made it through 2 brain surgeries and stuff. So for me, it's just trying to figure everything out because I don't know if my body would be able to do radiation. So for me, I can't have children. I'm 36. They're fun bags. They are not milk bags. So I'm just trying to be prepared for if something does go wrong is all, I guess.
Yeah, I appreciate that you have a lot of health complications and it takes a lot to be able to coordinate that care. So I appreciate that, bringing up these questions and making sure you're doing the best to advocate for yourself. I just will say that we do have things that even if they're not being done in our facility, that we can help support you to get the imaging and treatment that you need if you are to need that. Thank you for your question. Our next question is from Maureen from Marshall. Maureen, what's your question?
My question is about dental care. Is that something that you like to provide, or is it just difficult through the VA? I have outside dental care, but I was just wondering if that's something that you're comfortable and willing to provide, or is it kind of way backed up, in terms of dental care?
Hi, Maureen. This is Christy from the eligibility department. Dental has different eligibility determinations. So I would probably suggest calling our eligibility department directly, and we can look you up and see what your specific priority group is, and then we can check your eligibility. If you were not eligible directly through the VA, there's 2 dental insurance programs as well that offer discounted rates for their dental policies. So give us a call at the eligibility department and we can give you all of that information. Our direct number is 608-280-7038. Again, that's our eligibility department, and it's 608-280-7038.
Great. Thank you so much for the information.
You're welcome.
Yeah.
Thank you very much for the question. Our next question is from Linda from Freeport. Linda, can you go ahead with your question?
Hi, and thank you for being there tonight for us. I wanted to know if there was any updates on possible expansion of our CBOC down here in Freeport.
Hi, Linda. This is Kristen from Primary Care. Freeport is one of our sites that are on our radar for expansion. We are in the preliminary stages at this point in time, so I don't really have any concrete or solid details to share, but we do have a work group that is looking at our current space and making recommendations for a future space. So watch for more information to come. Thank you
very much. Thank you.
Thank you, Linda. Our next question is Myra from Baraboo. Myra, go ahead with your question.
My question is this. If us female veterans have to get some of our care over at a civilian hospital and our treatment down in at the VA, why couldn't our treatments be included at the civilian hospital with all of our other stuff? Like a mammogram. If we have to have a mammogram outside of the VA and we are diagnosed with cancer and have to go through the surgery and all at the civilian hospital, why could we not have the treatments afterwards at the civilian hospital instead of the VA?
Hi, Myra. This is Melissa again. Great question. With Mission Act and community care and all of that, there's all the eligibility that goes into it. First and foremost, we always want to provide the care for our veterans. We try really hard to ensure we have no wait times and that we can get everybody in timely. In this situation where mammograms, our VA here in Madison does not do mammograms. So it is a service we don't provide, which is one of the eligibility requirements that allow you to go to the community. So you would be approved for mammograms because we don't offer them. But if you are not drive time or wait time eligible or there's about 5 different criteria that allow you to go to the community and the VA to pay for those services, then we provide those here if we can.
Okay. Another question is this I have is the new clinic up here in Baraboo, are they going to also have x-rays as well as a lab to do? This way that we would not have to be going to Madison for those?
Myra, this is Kristen from Primary Care, sort of taking over for this latter part of your question. Baraboo will not have x-ray on site. We will have lab services.
But no x-rays?
Correct.
Thank you for your question, Myra. Our next question is from Peggy from Lone Rock. Peggy, please go ahead with your question.
Hi, thank you. Yeah, the question is, like at Madison VA, for the women's health, for like gynecology, there's only 2 primary providers. There's a male provider and 1 part-time female provider. Is there a possibility that they're going to have more female providers? I mean, I prefer a female than a male.
Hey, this is Dr. Marsh. So we do have plans. I'm not sure when it's going to happen to add another female gynecologist. So yes.
Thank you.
Thank you for your question. Our next question is going to be Katie from Madison. Katie, please go ahead with your question.
Hi. First of all, shout out to Judy from basketball. Like, she brings up a very good point about not seeing a provider or seeing a provider that's not scared of her vagina. Which also leads in the last question of getting more female representation for women, especially because we've had a lot of MST. But my question is kind of on that. I'm wondering if the VA will cover community care for mental health therapy, especially for programs that they don't cover, such as EMDR or that's just off the one that I was thinking of off the top of my head.
Hey, Katie, this is Sarah Fraser from Mental Health. Thank you so much for this question. It's a really good one. If you have there's a couple different ways we could address this. So if you have a current mental health provider, you can talk to them about your desire to try EMDR, and we can place a community care consult that way. If you're not currently receiving mental health services with us, we can get you started and meet with somebody to talk about like the need for EMDR. And there's different criteria for community care, but certainly we have people that are receiving EMDR under community care. So I would encourage you to give us a call. The mental health clinic number here is 608-280-7084. Again, that's 608-280-7084, and we'd be happy to talk with you further.
Thank you so much for your question. Sorry if we cut you off. So our next question is Teresa from Rockton. Teresa, go ahead with your question.
Yeah, my question has to do with community care. I have had several appointments. Like I am at high risk for cancer, so I'm supposed to do more the scope thing. I can't remember what it's called. I don't know why I lost what it's called. Anyway, they scheduled me for an appointment for that, and then they canceled it, and then never rescheduled it. And they did that twice already, and now I'm being told that, or the second time that my community care appointment was canceled, that I need to resubmit again for the third time for that. I also have had another community care appointment I had an appointment for dental, and they called me up and told me that I had an authorization for community care for dental, and I said, well, I already have a dental appointment. And they said, no, they canceled that to community care. I said, okay. I said, they didn't tell me that. She says, well, I'm telling you that now. And then I said, well, okay. She gave me the authorization number and told me I needed to call the community care provider and schedule an appointment. So I called her, and they told me that they never received an authorization. So they can't do the appointment because they don't have the authorization. And she asked me if I had the paperwork, because if I had the paperwork, then they could run a copy of the paperwork when I went for the appointment. But I didn't have the paperwork because they only called me and told me that I had an authorization number. So I'm having a lot of appointments that are being canceled at the VA that are being referred to community care that are being canceled. And nothing else is being done with those. So basically, I have appointments that I'm supposed to be having that I'm not. So is there a way that this can be fixed?
Hi, Teresa. This is Melissa again. Just so I understand, so you have appointments scheduled at the VA, and then they cancel them and refer you to community care?
Right. That's correct.
So when you are referred to community care, they should be calling you to have a conversation about if you would like to go be seen and receive your care in the community or not.
Not happening.
Okay.
Sorry. Teresa, this is Jim from Public Affairs. At the end of the call, because we can't dig in specifically about your information, you'll be able to leave a voicemail, and if you could make sure you leave your name and phone number, and we will make sure somebody calls you back.
Yeah, I can call you back afterward when I have your information.
Great, because I really need the stuff for the cancer screening for colonoscopy is the other one, because I'm high risk and I'm not getting my appointments.
Absolutely. Thank you for the question and advocating for yourself. Our next question is from Mary from Madison. Mary, please go ahead with your question.
Hi there. I don't even know where to start. Okay, so something I've dealt with, I've been at the LA and San Diego VA healthcare systems. I'm new to Madison within the past year, and something I'm noticing here is that the primary care providers, specifically at my satellite clinic, which, by the way, my name is not Mary and I'm not from Madison, but I prefer to be anonymous because you can look my name up online. But anywho, something that I've noticed is the care providers that I get look at me like, oh, you can't possibly be having that issue. You're not a real veteran, because you have a vagina. So when I go in and I say, listen, I'm dealing with this, and this, and the pain is extreme, and they ignore me for days on end, it's just frustrating. So getting to my question now, is will there ever be a female veteran-only clinic where we're dealing with providers who fully understand what it means to be a female veteran, because we are very different than the male veterans. And also, so we're not around the male veterans and the toxic male syndrome that is the VA.
Hi, Mary. This is Kristen from Primary Care. There's a lot in what you've just stated. I'm going to try to take it to the best of my ability here. We definitely recognize the sensitivities that our female veterans present with. We do have our designated women's health providers in all of our clinics, and they do go through extensive to provide female care. So what I would recommend, if you don't feel comfortable sitting in the waiting room area, just talk with the staff and they'll get you to a place where it might be a little bit more comfortable for you. At this point in time, we don't have a plan for a women's health only treatment center.
Okay, then what training are you guys providing your providers as it pertains to female veterans? Because I feel like it is severely lacking at my satellite clinic.
I'm going to just answer your question with a question. Do you have a female provider or a male provider at this time?
I have a female provider.
Okay. It just doesn't sound to me like maybe your needs are being met. So what you may want to do is just maybe consider requesting a different provider that definitely has that women's health designation, that's the training, and that might help. That individual might be a little bit more sensitive to your needs. The other thing that you can consider doing, I don't know distance-wise, but you can consider requesting to have your gynecological care at the main facility here.
Yeah, I'll also add we have a provider at the main facility who will be moving out to the West Clinic who only sees women veterans. So she, again, you might have to travel, but she also might be a good provider to fit your needs. Thank you so much for the question, though, and again, for advocating for yourselves. All right, our next question is Lorraine from Richland Center. Lorraine, please go ahead.
I'm a veteran from the 70s, and I had a pre-existing condition and was thinking about applying for a disability, but each time I did, I stopped it because it seemed like I couldn't go any further because I didn't have trauma when I was in the service. And I read somewhere that with a pre-existing condition, that if it has worsened, then I could be eligible for disability. Now what I'm asking is, does that still apply?
Hey, it's Dr. Marsh. So it's a difficult question without knowing a lot of details, which I don't think you should be sharing here.
Right.
But if you have a pre-existing condition and it's well documented, so it has to be in the medical record somewhere on your entrance exam, and that is shown, it is still possible. It doesn't preclude you from saying that you could not get PTSD service connected, but you'd have to show that it got worse through service. Or you could say that there was another condition. So again, this is really complex without knowing details. So what I'd recommend is oftentimes your county veteran service officers are pretty well versed in this type of situation, and they can help you out as far as figuring out how exactly to frame your request for disability.
Okay, what if it's documented in my service record?
Well, that would be helpful because then you can show you were seen for it. But again, you would have to deal with, could you show that it was worse? If it's definitely pre-existing or not. So
okay.
Yeah. All right, hope that helps.
Thank you.
Lorraine?
Yes.
This is Christy at the Eligibility Department. And I did look up the County Veteran Service Office phone number in Richland County for you if you wanted that number.
I have it. Thank you.
Okay. All right. Thank you.
Great. Thank you for your questions. We really appreciate everything, and that's all the time we have for questions today. Again, if we didn't get to your question, please stay on the line because in just a moment, you'll have a chance to leave a voicemail with your questions, comments, or feedback. Please know that we have recorded all questions and will make sure that everyone who raised a question and has not received a response or needs follow-up will receive a response. We plan to get back to you with a response within the next several weeks. Thank you for joining our telephone town hall and have a great evening.